of the quintessential family holiday, a family murder mystery and tragedy unfolding in New Jersey tonight. That huge arson fire at a mansion in Monmouth County yesterday. Turns out the man found outside was shot and killed, and his wife and two young children found inside were stabbed before that fire started. No charges have been filed in those killings, but the man's brother, who was also his business partner, is now arrested for setting his own house on fire a few miles away with his family inside. The question tonight, are these two crimes linked, and how and why?
For answers, let's go back to February 19th, 2018.
Hey, Sue, how are you? Sorry, they're calling the house line. I'm looking for Paul. I know he's sleeping, but I need to talk to him. Yeah, that's fine. Thanks. Yeah, please. I'm on my mobile. Thanks. Yeah, thanks. Bye. I just spent the last hour and a half on the phone with the insurance company. They're saying they haven't received any money and that they took a loan against my account and they're taking another one in October, which is just in October. I need to know, show me where you're sending the checks in online. You're writing them out online. I need to know where they're going. I need you to wake up there and do it. Short of you being dead, I need to see the stuff. You need to log into your account then. You log into the TV account. You need to give me the log into the TV account. Your TV account, you don't know yours? You don't know your TV login. Go find it and give it to me. I need to see it now, Paul. I need to see it. I need to see it now. I understand, Paul. I understand that. I just spent half the day. Paul, I'm telling you, I need it. I need it. I need it. Give me the fucking login, Paul. Give me the login, Paul. Paul, just give me the login so I can see where the money went. They get on your computer and tell me where the money went. Paul, somebody else could read it to you there. I need to know where that money went. Look a little while, Paul. I understand you're saying you need to wake the fuck up, Paul. Paul, I'm telling you, I just spent half the day looking for this. I need to know where it went. Paul. Paul. Are you sure it went to the right place this time? You have cash checks? You have cash checks? Paul. I hear what you're saying. Paul, I'm worried. I need to know where it went. Alright, an hour or two. An hour or two. An hour or two, Paul. That means by 8 o'clock.
What we just heard is a phone call made by Keith Canerio to Paul Canerio. The brothers shared a business and a trust fund. The latter's primary function was to pay for Paul's life insurance policy, but Paul was using it for other purposes. When Keith finds out, he confronts his brother. He wanted to see where the money was going. It would unfathomably be a dire mistake. Under the cover of night, Paul travels to Keith's mansion. He disables the power to his brother's house. He cuts fiber optic cables, disabling communications and other internet-connected devices, like the security cameras. When Keith goes outside to check on the problem, he's ambushed by Paul. He proceeds into the residence to maul and mutilate his sister-in-law Jennifer. Even his 8-year-old niece Sophia and 11-year-old nephew Jessie would not be spared from his wrath. He tried to cover up his actions by setting the house on fire. Unfinished, however, Paul then goes back home to set his own house on fire with his wife and daughter still inside the house.
911, where's the emergency?
Hi, my neighbor's across the street. There's a lot of smoke coming out of the house.
What's your address?
15 Willowbrook Road.
15 Willowbrook Road?
Yes.
And what town?
Portsmouth, New Jersey.
And what's your name?
My name is Kathy.
Kathy, Dan, what phone number you calling from, Kathy?
Yeah, if somebody could send it right away.
What's the phone, Kathy, what's the phone number you're calling me from? And do you know if anyone's in the residence?
I'm calling my neighbor. They're not answering, and I don't think anybody's home.
Do you see any flames? Do you see any flames or just smoke?
A lot of smoke. I can't see if there's a fire. It's on the other side of the house.
What address are you calling from?
I'm right across. I'm sorry, what street you said?
You're right across the street?
I live right across the street.
All right, we'll get somebody right out there, Kathy.
Okay, thank you.
All right, bye-bye.
Hello?
Hi, I didn't hear your
Hello.
name or what you're reporting, sir. What are you reporting?
Okay, fire.
Where?
Willowbrook Lane, Willowbrook Road.
What's the address?
Portsmouth.
Okay, what's the address?
I think it's 40, I don't know, I think it's 44 Willowbrook.
What's on fire?
This, Huh?
What is on fire?
the house.
Where do you see flames coming from?
I see the smoke from behind. I pulled out my neighbors from behind me. I opened the door, and there is a smoke's coming out, and there's a person laying down
Where are they laying down?
on
Can
the
you get
property.
over? Can you get over
In
to
front
them?
of the house.
All right, get over
Yes,
to
I'm coming over.
Okay.
Oh my God, there's blood here. It's a corpse.
It's what?
It's dead.
What's dead?
Somebody is dead here.
Okay, sir, you need to get to a safe area. Hold on a second. Sir, are you getting into a safe area?
I'm leaving the property.
What is the house number? Are you able to see it on your way?
Let me get to the parking. Let me get to the. Just 1 second. Just 1 second. It's I'm sorry. It's 15.
Okay, it is number 15. Okay. Give me your name again, sir.
It's 15. Get over there, and I see the body on the premises.
Yes, I told them. Just keep everybody away from that, okay? What is your name, sir?
All right.
What is your
My
name?
name is Boris Volstein.
Can you spell-
Boris Volstein.
Can you spell it for me?
V-O-L.
Yeah.
Okay, VOLSHTEYN, and I am at 2 Evergreen Lane.
Okay,
I'm right behind them.
All right, now what is Volstein your first name or last name?
Okay, Boris is my first name.
Boris, okay.
Holstein is my
Okay.
last name.
Okay, what's your phone number? And what's your house number on Evergreen?
Okay, listen, I really don't have time. I'm sorry. I need time to get on the property. Please send somebody.
They're already en route.
Hey, you want me to get them out?
Yes, yes. Get them out, we'll get the neighbor.
Yeah, I think we're enough.
Start that neighbor's evacuated. Can you guys go somewhere further away? Because it looks like a gas meter. Okay, so go down the street. Man's over there? And across the street, things good? Yeah. Okay, I just moved them to get further away for right now. Is anyone answering that? You can say it back wall. That's near. You can say it back wall if you're asking what's your name? Get a bit? Okay. Phone number?
Pause for a second.
Yourself. Sorry? Yourself? Did you guys in-house move everything like your chest stick? You want to, yeah, my parents somehow. Okay. Do you want to know check it out? It's like you if you want someone to come look at it, see if you can get it. I'll go to it. That's all fine. Yeah, that's going to be in a minute. Okay. Good, and here's in the house. That's my daughter. Okay, what is your name? Caitlin, K-O-T-E-L-Y-N. K-O-T-E-L-Y-N. And Melissa. What's Melissa's date of birth? And Caitlin's? Okay, so... Sure on, you good? You said asthma? Yeah. Okay. I was making sure it's not smoke related. Yeah, no. Okay. So what is that happening? You're sleeping and... Sleeping, the alarm from the house was full of smoke. Yeah. I didn't even see the smoke at first. We saw the smoke right away. Oh my God, it was so quick. Your bonus are going on out of the house. We don't have to send away our shoes. But, anything else? And you didn't see any claims inside or anything that you saw smoke? No, I got now you got every so got your daughters and dogs and yeah. that's where my mother started.
Yeah. That's what I saw when I came outside. I saw it.
Is there anything plugged in down there? No. Okay. Alright, so I went to back.
Fire out?
No, there's something. It's inside of the roof, so you have to go inside.
It's your house? Yes. Where is all the DVD stuff for the cameras and everything in the house?
It's in the garage.
It's in the garage?
Yeah.
Where in the garage at?
You walk in the garage and it's all the way up top to the left.
On top to the left? Do you have them running right now?
I've been having problems with stuff in the garage.
You've been having problems with stuff in the garage?
Yeah.
Okay.
I've taken over actually with one of the companies.
Okay. All right. When you walk in the garage, it's to the left. Not upper left corner. He said he's been having problems with his cameras. Alright, that one. 620, copy that. Is the DVR for the cameras a white box? You don't know? Okay. He's not sure. Say that.
Is this you walking?
Yes, it is.
What are you holding in your hands?
The DVR unit. As well as wires.
And is there another box too?
Yes, there was.
So you had two items?
Correct.
What was the other thing?
I'm not sure if that was the router. From there, I do not know what that was.
Who is this gentleman in plain clothing?
That is Chris Sorrentino. That was the first firefighter on scene.
Who is this officer?
That was Patrolman Bernhard.
In order to understand exactly how this whole malicious attack unfolded, Dr. Alex Jong and Lauren Toma, Chief Medical Examiner for New Jersey and Middlesex County Regional Medical Examiner's Office Deputy Chief Medical Examiner, respectively, take us through the series of events that most likely attributed to and ultimately caused the deaths of Keith, Jennifer, Jessie, and Sophia Canerio.
See the markings on the back of that? S-299?
Yes.
Okay. Did you recognize this jacket?
Yes, indeed.
Okay. And did you take notes? Did you take note, as you just talked about, of any defects in a certain area within this jacket?
Yes, indeed.
And where was that generally?
Yeah, just the holes on the back of the hoodie area. Also, you are notice in the right edge of that hoodies, there's a large defect.
Okay.
Can I have the back table, please?
Can I have slide 10, please? Doc, do you recognize that photo?
Yes, indeed.
And what does that photo show?
Like I mentioned before I start autopsy, the first thing I want to know what's happening. And this case, I was doing other autopsy during the daytime. I didn't went to the scene. But
Sorry, Doc, I just took it down briefly while you were talking.
The investigators went to the scene. So they took photos, reflect what's happening at the crime scene. So we can see, the person lying face down on the grass level. Also investigating report not far from the garage. It was found face down with gunshot wounds.
Okay. Now, Doc, just briefly, can I have slide 11? What are we looking at here specifically?
On the scene photo, actually, you can see that this green is grass. On the hoodie, the right side hoodies, you see a relatively large defect. And even...
Sorry, I don't want to leave it up too long. I know you're...
Okay.
So, I also want to show you, because you talked about a defect in the underwear, is that correct?
Correct.
Can I have slide 5, please? Do you recognize that photograph, Doc?
Yes, indeed.
And what are we looking at there?
It's look at the underwear put on the table. Look at on the back of the underwear. There is a short blood stain, more concentrate on the upper portion. There is a small defect.
Now, Doc, when we talk about defects, like the one on slide 5 in the underwear and the one that we just saw on the hood of the jacket, as part of your autopsy process, do you try to line up defects in clothing with injuries on a body?
Correct.
Okay. Were you ultimately, I'm not going to ask you what that is yet, but were you able to do that at times during the autopsy?
Yes. In this, sometimes I'm not 100% sure, but this case, yes.
Now, I want to ask you about the process you talked about, and I know you kind of described how you go about doing autopsies, but in this case in particular with respect to Mr. Keith Canerio, were x-rays taken?
Yes.
Okay, and can I just can I have slide 4? Before I ask you what that shows, can you just tell us, like, kind of when these are taken and what the purpose of them is?
This is X-ray. We took the X-rays from front to back. Before autopsy, yes, you can see multiple skull fractures in the head. With you see like 3 pieces, high density object inside. That is due to the fragment of the bullet.
Okay. You can go back. Now, when we talk about an external examination that you conducted upon Keith Canerio, do you kind of give a summary of that on page 2 of S380, your report?
Summary, the which page?
External examination, page 2. Doc, do you see where I'm referring to?
No, I'm not. I'm not sure.
Okay, so the bottom of page 2, is there an area that says external examination?
Yes, indeed.
Okay, and part of that would include what you talked about with respect to Keith Canerio's height and weight as well as his age, correct?
Correct.
And do you make any other observations about his hair, about anything that was found upon his face, or any other injuries at that point externally?
There was a multiple gunshot wound around the head and face, and the face is covered with blood.
Okay. Now, in that photograph, the slide we looked at before, I believe it was slide 11, you saw grass, correct?
Yes.
And did you also see leaves?
Yes.
Okay, and did you see any evidence of that or any remnants of the ground upon Mr. Canerio's face?
Yes. Actually, there's a dirt inside of on the surface until tongue, and the tea leaf on the left upper lip.
Is it a tree leaf?
The tree leaf, yeah.
Now, as we move on with your examination, do you note in your report, and did you note it at the time of the autopsy, approximately how many gunshot wounds were observed upon Mr. Canerio?
There are multiple gunshot wounds, but 2 of them I consider 2 actual gunshot. I think it's a re-entrance wound, and one is 100% sure is a re-entrance wound. Another wound can be another shot. So my interpretation, so there are 5 gunshot wounds.
Okay. When you classified 5 gunshot wounds, does that include certain ones where there's entry, exit, and possible re-entry?
Correct.
Okay. So just to make that clear, I want to specifically refer you to the first gunshot that you classified, or the first area of gunshot that you classify in your report at page 3. Do you see that?
Page 3. Yes.
Okay, so you see that. Doc, when you talk about the fact that you numbered them 1 through 5 in your report, you did that, right?
Correct.
Now, do those numbers, do they relate, or are you making any opinions as to the chronology of those gunshots or the sequence of them?
No.
Okay. Is 1 through 5 for ease of explanation, so to speak?
Yes.
Okay. Now, when we talk about that first gunshot wound, could you tell us, can you tell us where it is and the actual wound track and that sort of thing?
Yes, this gunshot wound is in the left lower back on the junction with the left upper buttock, close on the left side, close to the vertebral bodies. There's an entrance wound, and there's also on this wound I didn't see third compound stitching or muscle imprints around the wound, and on the right abdomen I see the exit wound. So the gunshot, through the, and another thing that I want to mention to you guys, when I mentioned the direction the bullet travel, is based on the body is in anatomic position. I'm going to identify what is anatomic position. It's basically you stand still, you face forward, you palm forward, you both feet forward, called the standard anatomic position. Whatever I mentioned direction is based on that, not based on real when the body was shot. The body can move around. The direction also can be changed in certain degree. So, thank you. You want to me?
I'm sorry, Doc. So you talked about the gunshot wound number 1, correct?
Yes.
Where does it enter the body?
It's on the left lower back. Is like a left upper buttock sides.
Okay. And Doc, once that bullet enters the lower back area, where does it go?
You see the on the left lower buttock area. So the immediately fractured called the sacrum bone is the middle bone on the pelvic area. The fracture that sacrum bone, then before in front of the sacrum bone is rectum. They perforated the bone, then perforate the rectum, then they perforate the urinary bladder, and the travel from back to the front, left, right, and also had a little bit the upper version. So you see after perforate the urinary bladder, then they perforate a different part of small intestine multiple times, then exit from right abdomen.
Okay, so it comes in the back and ultimately travels to the body, causing the injuries you described. Then it comes out of the abdomen, correct?
Correct.
Once it comes out of the abdomen, where does it go?
The axil wound can slit axil wound. So when they come out axil wound, I identify I classify the re-entrance wound. They have a similar shape, slit axil wound on the palm, just beneath the thumb. Then exit on the back of the right hands.
Okay. Can I just briefly have slide 6? Doc, do you recognize that?
It's
Doctor, you have
the
you have it in front of you too, if that helps.
It's an entrance wound.
Okay, is that the entrance room on the rear of the lower back of Mr. Canerio?
Yes, indeed.
Now, can I have slide 7, please? Do you recognize what that shows?
This is the axil wound I mentioned in here. In here in the abdomen.
Okay.
And also I showed the re-entrance wound on the palm surface. So I consider when they come out from here, the hands happen to be in front of the bodies. They re-entrance from palm surface, then exit from the back of right hands.
Ronald, can we preserve that as 7.1? Thank you.
Sure.
And Doctor, on the bottom of the screen, once you hear that printing, you can hit undo. And can I have slide 8, please? Do you recognize what that shows?
Yes.
Okay, and what does that show?
Again, show when this wound is come out, and also show show the exit wound on the back of right on the back of the head.
So, Doctor, despite seeing marks of injury on the lower back, the right abdomen, the inside of the hand, and the outside of the hand,
yeah.
Is it your expert opinion that this is one gunshot?
Yes, indeed. But certainly, if this case, this specific the gunshot is my opinion, can be. I'm not 100% sure. There's no addition one shot through the hands.
Now, also on page 3 of your report, you talk about gunshot number 2, and that is in a different area, correct?
Correct.
Can you tell us what that second gunshot?
The second gunshot wound is basically I use my body to demonstrate. Is the gunshot wound on the right lateral neck. The exit from the right medial neck and the re-entrance wound from the right lateral face and exit from the right cheek area.
Can I briefly have slide 13? Doc, does that photo assist with the identification of
Yes,
entry
indeed.
and exit?
Yes, indeed.
Can you see the entry and exit wounds on that photograph
Yes.
for gunshot 2?
Yeah.
You marked them with the...
Yeah, indeed. So we now look at the face from the right side. Look at the face. You can see entrance wound on the right neck. They exit from the right lateral medial side neck. Re-entrance in here. Then the bullet travel to here. So the bullet exit from the right cheek area.
Can we preserve that, please? 13.1.
13.1.
Now, all right, slide 18. Now, Doctor, do you recognize what slide 18 shows?
It's yes, indeed.
What is it?
It's the body diagram, which during the autopsy identify where's injury, the location, the measurements.
Is that something that was created by you, all that writing?
Correct.
Now, with respect to that second gunshot, can you just identify via the diagram potentially where you noted the wounds associated with gunshot 2?
Yes.
And there's a pen there, Doctor, if you stylus.
I'm sorry, my hand's shaking. I mean, that like entry down there is shot from there. The shot from right. Yeah.
Just put a number 2 under there somewhere.
Doctor, can you put the line?
Oh, I'm sorry.
We're going to preserve that.
I'm sorry. I can.
That's okay.
Up there. Number 2 is in here. Gunshot 2. The entrance wound, I use arrow on the right lateral neck. Then direction is from here. Sorry. Can't reach. It's not very sensitive, but anyway, I'm not going to line the line, just confused. You see from the right lateral neck, the exit in the right cheekbone area.
18.1.
Thank you, Jim. Now, I want to move on to page 4 of your report. You talk about the third gunshot wound, correct?
Yes.
Can you explain where, can you undo that? Just hit that little undo button. That third gunshot wound, can you tell us where that was located?
Is this on the right lateral face? I use the dots. Yeah, I use my fingers. Now pinpoint my lateral face. There's a entrance wound on the right lateral face.
Doc, can we just preserve that, sir?
18.2.
I'm going to ask for slide 13 again. Doc, does that photograph assist in the identification of that?
Thank you. Yes. You can see on the right lateral face, slightly below right ear. On the face, you can see there's a relatively large irregular abrasions on that wound. It's just upper, is in here. I'm sorry, now I can. That is number 3 entrance wound.
Okay, and we could preserve that. Where does that wound?
Slide 13.2.
Doctor, where does that wound ultimately exit, the third one?
So this wound is traveled from right to the left, and also this wound also from the slightly upper angles and exit from the left side face.
Can I have slide 15, please? Doc, you could just hit undo on this one. Do you recognize what we're looking at here?
Yes.
What are we looking at?
This is, I just mentioned, the shot on the cheek, lower cheek area, the travel from right to left and from bottom to right side. We can see there is a irregular axis wound we call short axis wound. They are located on the left side face, just from the left lower ear. The reason called short spelling is H-O-R-E-D. The short means is the bullet when they perforate the body, when they exit, they tend to be push the skin out. So normally a typical axis wound, you can see the holes or lacerations. On the surface, you won't see any abrasions. But in this case, they have like abrasions around this gunshot come out the skin. The skin surface will be against that object that created abrasions. So this is called short exit wound.
Doc, you can take that down. Now, Doc, with respect to that third gunshot wound, the one that went in the right side of the face with the short exit wound to the left side of the face, did you evaluate that in conjunction with...
Slide 15.1.
We went too fast.
We need to go back, sorry.
Go back to 15
We didn't get it
first.
fast enough.
Sorry. Doc, could you just circle that wound again? And we'll
We can print that 15.1.
Okay.
Once you hear the printer, then you can hit undo.
I can do it, right?
Yes, you can, doctor.
Doctor, I was saying, did you evaluate that third gunshot injury, the one to the right side of the face, in conjunction with the black hooded sweatshirt or jacket that you described earlier, you saw earlier?
Yes.
Okay. Did you receive any information from the New Jersey State Police Trace Evidence Unit which helped you in making that conclusion?
Yes, indeed.
Okay, and ultimately, what was the determination that you made with respect to gunshot injury 3?
After received that information, I combined the scene investigation. Do you see when the body was lying on the ground with the larger holes on the right lateral hoodie area? And later on, that hoodies, when they sent to the police did a gunshot residue studies. Based on police report, that the large hole is which later on I associated with the gunshot wound on the right lateral face. Based on the police study, they consider they have residues down. They consider either contact with the hoodies or or near contact with hoodies when the fire shot. Then I reviewed my autopsy. You remember I just showed that wound. They have regular large abrasions around the entrance wound compared with others. I consider that irregular abrasion may be associated with muzzle imprints. When the gun against your face, you can create irregular abrasions. And also you remember I just showed the short exit, and during autopsy I see the leaves on the upper lip, the dirt on the tongue, and the body was face on the ground. And also I have information. There's initial information. There is a bullet identified on the ground just beneath the head area. So based on all those features, later on I issue an addendum report. I consider this person already lying on the ground. The fire shot is against or close to the right side face, then push body downward. So the face, left side face against the ground, and create abrasions. And when your face move forward to the ground, you create a compressed area on your left side face, and the dirt push you the contact with the tongue. The leaves had contact with the upper lip. So I consider when this shot fire is the person already lying ground, either dying or already dead. That shot, it's dying. Since I see abrasion, that means the person now dead. When you fire shot, you can see red abrasions.
Doctor, culmination of that autopsy, did you draft a report?
Correct.
Okay. And did that report ultimately include toxicology, the actual report, as well as your body diagram and some other notes from the investigators?
Yes, indeed.
Okay. I'm just going to show you what's been marked as S382 for identification. I'll ask you if you recognize that, doctor.
Yes, this including my autopsy report, which have the name Sophia, Canerio, and the case number is 13-18-1301. The case 13 is the county of Thomas County. The 18 is the year of 2018. Case number 1301 is a specific related to this case. So in all the following photos, they all have this label associated with this case.
Now, doctor, with respect to the autopsy that you conducted or performed upon Sophia Canerio, did you do it in a similar manner to which you had done for her father, Keith Canerio?
Yes, indeed.
Okay. Did that include x-rays that were taken prior to any real internal or external examination?
Yes.
Okay. Can I have slide 20, please? And doctor, do you recognize slide 20?
Yes, indeed.
What do we see there?
We show the body was lying on the table. We take the photo of the bodies. On those, there is show the EKG leads on the shoulder area. Also, is also a little bit high density. The pieces, actually, they are not bullet. They are just gravel stones. Since the initially body was found the first landing between the first floor and the second floor, they moved the body from the fire site to the gravel surface. So those stones is contamination basically on the ground, and show the injuries on the. You can see on the right side chest. If you compare the left side the chest, it's all quite black. That means the person also have what we call the pneumothorax, the air into the right chest. So the compress the right lung. Normally, the chest cavity is negative pressure, so you can expand the lung. So, and also the lung is collapsed, and kind of push the heart towards to the left side, the bodies. And yes.
Okay. Can we preserve that, please?
20.1.
Doc, you can undo that if you don't mind. Doctor, as part of any autopsy, and specifically this one, did you take note of any clothing that Sophia Canerio was wearing at the time?
Yes, indeed.
Okay, and that was 2 items, correct?
Yes.
What were they?
They were, one is a shirt, one is underwear.
Okay.
The shirt is, which is covered with blood.
Okay. Now, can I just have slide 21? Do you recognize that, Doc?
Yes.
What is that?
It's basically, in this case, later on, I will introduce other evidence. So they are in the fire scenes. So you can see the clothing already partially burned. So I have cut on the surface, lateral surface, in order to preserve the evidence. So basically, this shirt on the purple one is on the back. The body is protected, clothing be burned, were burned. So on the top is a front shirt. In the front shirt and also on the back, you see a lot of empty space that later on correlated with the stab wound. When you perforate the body, create a defect on the clothing.
Now, Doc, during the course of the beginning of your report, specifically page 2 of that document, you go on to describe your initial impressions of Sophia Canerio, correct?
Yes.
And that included the fact that she was 48 inches, right?
Yes.
45 pounds?
Correct.
And she was how old?
8 years old.
Okay. Did you describe her hair color?
Yes, it's she has a light brown hair, but the hair, top of the hair, is I described in my report, it's a singe. That means get thermal burns. Not totally burned yet. You start, after burn, you start shrinking. A singe.
Doctor, were you able to evaluate or determine her eye color?
Since with the thermal burns, you really cannot see real color since have a thermal burn effect.
Did you document that there were large stab wounds on the left side of her nose?
Yes, indeed. There's a multiple large stab wound on the left head.
Okay. And did you note something regarding the upper frenulum?
Yeah, the upper frenulum is a small ligament between in the front line, in the upper lip area. So that small ligament is teared.
Did you make any observations of whether or not there was any blood in her mouth?
Also, there's a large amount of blood in the mouth.
Did she have multiple cuts and stab wounds to the chest?
Yes, indeed.
Okay. And was her face covered with blood and soot?
Yes, indeed. The whole body are covered by soot. So make me, in this case, very difficult doing the autopsy since the soot and the dry blood cover the wound. So we have to really carefully clean the wound in order to identify the nature of injuries.
Did you note at times in different places radiant heat burns?
Yes, the whole body, especially in the front, show the radiant thermal burns. On the back, get partially burns. But certain area is still preserved, especially when the body against, like buttock area, against the floor. They are kind of protected by body positions. In those areas will be less burn.
Now, doctor,
or unburned.
Now, doctor, during the course of the report, you document evidence of injury. Is that accurate?
Correct.
Okay. And you described in the beginning, part one, you described evidence of sharp force injuries. Is that right?
Yes.
And what did you mean when you said sharp force injuries?
Generally speaking, we talk about sharp injuries is by sharp instrument, either with a pointed or sharp edge. So those injuries is due to cut, not by force. The blunt force injuries by force that break the tissue, tear tissues. The sharp force injury is cut motion into the body.
Okay. Now, doctor, if you recall, is it accurate that you documented under sharp force injuries 17 injuries or groups of injuries?
I artificially divided like 17 groups based on locations, but not means 17 injuries. It's 17 group injuries.
Now, I know that you document a lot. We just said it was 17, but I'm going to refer you to that report that's in front of you, if I can.
Yes.
And specifically, I just wanted to just note the number. The record we're looking at S382, correct?
Yes.
Now, I'd like to start with number one and ask you that first injury that you noted.
The first injury is like a deep cut on the right top of the head, which the cut length is 1.5 inches.
Okay. And the second injury or group of injury that you noted was what?
Is injury, the stab wound on the back left armpit area, which 7 1/8 inch in length and 1/2 inch in width. Normally, we mention the stab wound. If I mention the length of the wound, tend to correlate the width of the blade. And the depth wound tend to associate the length of the blade, but certainly not the injury will be fully penetrated. But they're correlated a certain degree down there. So this, and again, I mentioned to you, majority thermal burns in the anterior surface. On the back area, some area is less burn or unburned. In that injuries, I try to identify the length of the wound. In the thermal area, I just mentioned whatever the size. Doesn't mean is the shape of the wound. So let me go back to, I'm sorry, I have to tell the jury whatever the preconditions. So this wound is a 7/8 inch, a little bit less than 1 inch, and the 1/2 inch in width. And the depth of wound is 1 inch. This wound is from the back to front and downward. Just remember, from back to front, downward.
And doctor, with respect to those measurements, I think you said it, but just to be clear, were you confident with respect to the measurements when you talk about 7/8 of an inch in length, 1/2 an inch in width?
So I put the notes, I'm sorry. In my report, I said notes, due to thermal injury, the measurement, the length and width of this wound are not accurate.
And it's not accurate because of the smoke and fire conditions?
Yes, thermal injury. When the thermal injury, your tissue is fixed. They can maybe artificial in large size, or maybe they smaller than real size.
Now, you note the third injury, is that accurate?
Yes.
What's the third injury that you note?
I noticed on the back, the middle of the back, the baby, there are 2.5 inches length cut. And this cut is certainly all the cut on the back is from back to front. Also had downward. The cut is downward to the body.
And then the fourth, I note that you indicate there's 2 stab wounds, correct?
Yes, there's a 2 stab wound on the right lateral buttock. The top stab wound measure 3/4 by 1/2 inches. The lower stab wound is located at a little bit non-thermal injury area. So this measurement is more accurate, like real injury patterns. I mentioned the length of that wound is 1/8 inch in length, 3/16 inch in width. When you look at that shape of the wound, there's one sharp edge, one blunt edge. So indicate the weapons, whatever stab to the buttock area, most likely is a single edge blade.
Again, is that what you just described? Is that back to front?
Yes, this wound is from the back to front and top to bottom.
So downward?
Downward.
Now, number 5, you talk about a superficial vertical cut at the right posterior lateral thigh measuring 3 inches in length, correct?
Correct.
Okay. And when you talk about right posterior lateral thigh, can you tell us where that is?
It's basically, I said, all the base standard position is on the lateral side of the right thigh, on the back lateral side.
Now, the 6th wound, again, I think it's 2 wounds at least, correct?
Yes.
Can you tell us about the 6th wound?
These 2 stab wound on the left side, the nose, measuring up to 1 inch in length. The wound direction is front to back, slightly, maybe on the left side. It's slightly right when I'm talking to the baby, the child, from the right to left, and slightly that is on the face, slightly from the bottom to top, slightly upward, and. These 2 wounds cut through the nose, cut through the nose, and through the sinus. And since I just remember on the left side nose, this wound from front step down the back, a little bit upward. So when the wound into the left side, the face through the sinus, they hit the bottom of the skull. The brain inside the skull. The bottom skull we call left frontal fossa. On the base of the skull, there are frontal fossa, middle fossa, and posterior fossa. So the knife penetrating front to back from slightly from the right to left and slightly upward hit the bottom of the skull and fracture the base of the skull.
Can I just very briefly have slide 22? You recognize that, Doc?
Yes, indeed.
Is that consistent with the injury you just described?
Yes.
Moving on to number 7, you document 6 cuts or stab wounds. Can you explain that?
There are 6 cut and stab wound on the middle anterior portion of the chest, in around the nipple level up and the lower area. There are total 16 totally 16 cuts and the stab wounds. Again, if we're grouping them together, they are going. The knife is going to front to back. One of the wound cuts through the right upper chest, which penetrated through the right and number 5, number 6 lateral ribs, create a cut, 1 inch cut in the middle of a right lung, and superficially cut all the way deep, cut into the back of the chest cavities. So this wound measure the depth of the wound around 3 inches.
Now, that group of injuries there, Doc, under number 7 that you just discussed.
I'm sorry, I didn't finish.
Oh, I'm sorry.
Yeah, let me finish the wound. So you remember the X-ray? There was a dark area on the right side lung. We mentioned the pneumothorax, since they cut through the lung, and also the wound, deep wound into the chest cavity, introduce air into the chest cavities. So this wound lead to the blood on the chest. We call the blood in the chest, and also have called the pneumothorax means air in the chest. So the right side lung therefore called lung collapse. I use term atelectasis, basically collapse lung, and push the organs, the heart towards the left. Since when you at least lost one side, you cannot breathe. When the lung collapse, you cannot change air. When push the heart towards the left side lung, also partially compress left lung, make the person difficult to breathe.
So what I was going to say is that's consistent with what you described earlier from the X-ray, correct?
Correct.
Okay. Now moving on to the 8th grouping of injuries. Can you describe that?
There is a stab wound on the right lateral chest. So this wound measures 7/8 by 1 inch. Again in the thermal area. Stab wound. This stab wound from right to left, slightly top to bottom. This stab wound through the skin, right lateral chest wall, through the ribs. They cut the fracture number 9. This through number 8 to number 10 ribs space. Into there on the way there, cut through the fracture or cut the right number 9 rib, and then when they initially go to the lower chest cavities, then after they go to chest cavities, they into the right side diaphragm. Right side diaphragm separate the chest organ and abdomen. Through the right diaphragm, then further into the liver, the right lobe of the liver. Certainly, when you damage the liver, you have a hemorrhage in the abdominal cavity. We call the hemoperitoneum. There is a small amount injuries, the blood in there. So this wound depth is around 3¼ inch in depth from the cut through the, we talk about baby, so it's almost through the right to the midline area. 3¼ inch in depth. Thank you.
Now, in the 9th group of injuries, you talk about 1 stab wound to the anterior right thigh, correct?
Correct.
And also 1 stab wound on the left thigh, correct?
Correct.
Okay. And the direction of those wounds was what?
From the front to back.
Okay. And did you also measure those?
Yeah, this is again the front leg was burned. So I measure 3¼ by 3/4. Another wound measure 3/4 by 1/4.
Now, number 10 is 2 vertical cuts on the medial surface of the right lower leg and 1 vertical cut on the medial surface of the right ankle. Is that
correct?
Okay. And they measure 2 to 3 inches in length?
Correct.
Now, number 11, you talk about a stab wound on the left anterior upper arm, correct?
Correct.
What's the direction there?
The direction wound is front to back.
Now just number 12 is a perforating stab wound of the right forearm.
Correct.
What does perforating mean? If you
Perforated again, the same concept, use bullet or knife. That means the knife enters the body, then exit from the body.
And that perforating stab wound of the right forearm, what else did you note in that regard?
So this, just remember, this entrance wound is located on the posterior lateral of right forearm, on the back lateral of the forearm, close to the elbow.
Okay.
And measures 1 inch by ½ inch. So this wound direction is back to front, and top to bottom. I mean, from shoulder is top, the hands the bottom. It's, remember, back to front. It's a little bit downward.
And just to that area, very briefly, Doc, can I have slide 25? Now, you talk about injury to the right forearm. Is that accurate?
Correct.
And you also
Yeah, I'm going to label.
Okay.
So the elbow is here. So the closed elbow on the back of the on the lateral of right forearm.
And Doc, just very quickly, do you see some of the chest injuries that you described earlier?
Yes, you see multiple gapping stab wound and all cut.
Can we preserve that and take it down?
25.1.
Doc, you talk about, if you could undo that, Doc. Talk about number 13 being a faint cut on the right forearm. Is that essentially in that same area you just described?
Yes.
It's like between the perforating stab wounds you just described?
And also there's a stab wound and the superficial cut on the right elbow.
Okay. And is there also, under number 14, is there a deep cut on the posterior right wrist?
Correct. The measuring 1 3/4 inches in length.
Okay. And then number 15 says vertical skin split from the back of the right hand?
Yes, indeed.
Okay, and that's toward the distal forearm?
Correct.
Ascertained due to the absence of the overlying skin. Do you see that? What does that mean?
So the wounds on the front of the body, the anterior torso, a lot of that skin was no longer absent due to the thermal effects, the fire effects burning the skin away. So the first surface that I encountered externally was actually some of the underlying musculature and underlying fat under your skin.
If I showed you your the diagram, the body diagram, would you be able to point out all of the subsequent, that one and the subsequent stab wounds on that diagram? Yes. If we could please have slide 37 again. Okay, so this injury that you just referred to, can you point this out for us?
So it's A on the diagram and A in the report. Sorry.
Thank you, Doctor. If we can move on to number 4. What is that?
37.2.
So number 4 is the stab wound of the left lower abdomen.
And where is that located on this diagram?
That is B. There.
And what, if anything, did you note about this particular wound?
So this is similar to the above wound A, where I could not examine the external features due to the lack of overlying skin remaining.
Now, with regards to these wounds, did you make any notations about the direction of the wounds? And I guess we'll go back if we could. I should have asked you with regard to the first one that you discussed, so number 2. Actually, it would be number 3 in your report.
Yes, so this wound enters the chest cavity on the left side and strikes the left lung, a portion of the left lung. This is from and when I state these directions in any type of injury, I'm simply talking about the body in this so-called anatomic position. So I'm looking at the external injury in comparison to the internal tract and describing that relation to the standard body axes. This does not mean that anyone was in any particular position. So this went from the front of Jennifer's body towards the back. It went from the lateral or left side of the body towards the midline.
And with regard to number 4, the stab wound of the left lower abdomen that you marked, and that, just to be clear, does that correlate to B? It's hard to see. Does that correlate to B, doctor?
It does, yes.
Okay. Can you just, again, describe the direction of that wound and any other observations that you made about it?
Sure. So this was a shallower wound compared to wound A. It did not enter the body cavity or the inside of the stomach area, what we call our stomach, but the inside of the abdomen, peritoneal cavity. So it did not go through it did go through the peritoneal wall, but it did not strike any of the abdominal organs.
Can you say anything about the depth of that wound?
It was up to an inch, but hard to say because I didn't have the overlying skin.
Now, with regard to wound number 5, what is that?
Wound number 5 is a stab wound of the right breast that I'm indicating here, marked with C on the diagram, as well as in the autopsy report itself, page 4, about halfway down.
And what was the estimated depth of penetration of that wound?
This one went much deeper. It was approximately 3 to 4 inches.
And can you tell us anything else that you noted about this wound in terms of its characteristics?
This wound was associated with injuries to both the middle and lower lobes of the right lung, and there was also, not sure if it'll let me write this. I can't read that, sorry. 900 milliliters of blood in the right chest cavity.
What, if anything, does that indicate to you, the 900 milliliters of blood in the chest cavity?
So all of these wounds, with the exception of B, clearly have hemorrhage associated with them, both in the wound tract itself, as well as around defects in the left lung and the right lung, and bleeding into the body cavities, which leads me to conclude that she was alive and actively bleeding while being stabbed, or was stabbed and then could bleed, so to speak.
The direction of penetration of this wound was what?
This is wound 5, so this again is front to back and downward.
We could move on to wound number 6. What is that?
Wound number 6 is a stab wound of the left mid-back. That is here.
The record, we just know you're noting that.
I'm noting that. Sorry, this is a very blunt instrument.
And what, if anything, did you note about this particular wound?
So this wound penetrated, went entirely through the posterior chest wall and entered the chest cavity. I was able to trace tracks in the lower lobe of the left lung. There was 600 milliliters in the left cavity, but because there were defects from both A and D, it could be from one or the other or both.
Can you say anything about the depth of the penetration of that wound?
Yes, this was another one of the deeper wounds with the estimated depth of penetration 3 to 4 inches.
We could move on to wound number 7 now. What is that?
Wound number 7 is a stab wound of the left lower back. It's here on the diagram. It's hard to see, but it's right there.
What, if anything, did you note about the characteristics of that wound?
So this wound, I was able to get a better look at. The skin was preserved. So I was able to give when we describe stab wounds, we describe the length of the wound on the surface of the skin with skin tension. So sometimes the wounds get pulled apart by the natural fibers in your skin. And without skin tension, so I cut around those and sever those fibers so I can get a truer appearance of how long the wound is on the skin surface. So this one was an inch long on the surface, both with and without tension.
Were you able to do that with regard to the other stab wounds?
I was able to do that with the stab wound D of the left mid-back. The other stab wounds on the front of the torso, A, B, and C, again, the overlying skin was no longer present, so I could not give an estimate of how it appeared on the skin.
We could have slide 34, please.
Hold on, so let's print. Can you go back for a second?
So this is the skin of the lower back. This, it's hard to tell because it's zoomed in. Usually the number indicates the feet. I'm not sure this one is. I'm just making sure that if it's D or E. They're both oriented obliquely, and they both have similar external characteristics, meaning they have a length of 1/2 inch, so that's this length, as well as a little tail, so to speak. These kind of irregular wound edges can be produced if, once the knife enters the body cavity, either the person holding the knife twists the knife, or if the person being stabbed with the knife turns away, or a combination of both. So you get those irregular wound edges as the knife changes orientation and is pulled out.
Thank you. I'm going to take this one. Just go to the whole screen.
We just have to print that. Can you go back just for 1 second? 34. 34.1. Thank you.
Doctor, could you determine, as a result of your examination of whether at the time of her death she was suffering from any natural diseases?
No, I proceeded with the internal examination where I examined all of the organs for injuries and signs of natural disease, and she appeared in good health that I would expect from a 45-year-old.
Okay, so could you determine whether any natural causes contributed to her death?
No, there was no natural disease.
Now, based on your examination of Jennifer, and in light of your education, training, and experience, were you able to come to a determination as to the cause or mechanism of her death?
So for the cause and manner?
Yes.
Okay, so yes, I was.
Okay, what was the cause first?
So I'm going to talk about mechanism, which I don't normally do because it's not specific, but the mechanism in this case is blood loss. So that's the specific physiologic derangement that causes somebody's life functions to cease. So because you can have blood loss from a bunch of different factors, we don't leave that alone on a death certificate. But because the mechanism involves both types of injuries that cause blood loss, the gunshot wound to the head, as well as bleeding internally from those stab wounds, I combined them in my cause of death statement, and I listed it as gunshot wound of head and stab wounds of torso.
And on what did you base that conclusion?
So there was a significant amount of blood in both chest cavities, and so-called softer findings, such as organ pallor. So one of the reasons your skin and your organs appear certain colors that you have circulating blood. So if you're losing that blood volume, you can look very pale, as can your internal organs and your mucosal membranes.
Now, based on your examination of Jennifer, in light of your education, training, and experience, were you able to come to a determination as to the manner of her death?
Yes, I was.
And what was that?
So the manner of death is just basically a shorthand way to explain how the cause of death came to be, so it's the circumstances. So since these injuries were inflicted by another person or persons, the manner of death is classified as homicide.
Okay, and then what did you base that conclusion?
In my opinion, she did not do this to herself, and it didn't happen accidentally, and it's not natural because it's injuries.
Thank you. Doctor, on November 21st of 2018, did you also perform an autopsy on Jessie Canerio?
I did.
Did you document that examination in a report?
I did.
I'm going to show you and showing counsel what's been marked as S378. Do you recognize that?
So this is the report that I previously looked over and has those same components, the autopsy report, toxicology, investigative report, and additional body diagrams.
Now, what is the date of that report?
So the report was signed on February 1st, 2019.
And does it document the date and time that the autopsy of Jessie was performed?
Yes, I performed the autopsy on November 21st of 2018 at around 2 p.m.
And what was the age of Jessie?
So I was told that Jessie was 11 years old.
And did you take notes on a body diagram with respect to Jessie's autopsy?
Yes, I did.
And if I showed you that diagram, would that assist in explaining his injuries?
Yes, it would.
Now, we talked earlier about the protocol for performing an autopsy. Were you able to follow that protocol in Jessie's case?
Yes, I did the same basic steps.
During your examination of Jessie's body, did you note anything about his physical condition, including any clothing, height, weight, etc.?
So, starting at the top, I noted that he was only wearing light-colored briefs that were blood-stained and also very wet. He had no personal property that was on his body, but a blue earring was found within the body bag.
How about his weight?
He was 95 pounds.
What, if any, other observations did you make about Jessie during that external examination?
So he had some what we call skin slippage, or loss of the overlying layers of the skin. These can be caused by decomposition, where the bonds break down. But in this case, my opinion is that it's caused by exposure to heat, not obviously as direct exposure to as Jennifer's body was, but there was some heat near him. He's has some superficial blistering is another word for it, and there's also some brownish discoloration, not quite charring, but just some changes of the skin on the body.
What, if any, post-mortem changes did you note about Jessie's body?
So he had rigor that was able to be evaluated. It was moderately difficult to break. He had purple posterior lividity that was slightly blanching, and his body was cool, but both bodies had been refrigerated.
I don't know if you explained it, but just lividity, what is that?
It's cooling of the body's, the blood in response to gravity. So in whatever position you die in, your heart's no longer pumping, the blood is going to settle downward to gravitational forces. After a certain, or before a certain period of time, it's still located within the blood vessels themselves. So you can actually push on the body's surface and move, physically move with your hand, the blood out of those vessels. It's called blanching. After a certain period of time, those blood vessels themselves start to break down, and the blood seeps into all of the other body layers, so the fat, and that's called fixed because it's not in a blood vessel anymore.
So in this case, did the lividity tell you anything at all about Jessie?
Honestly, we document these things because they're part of the standard protocol, but they're very rarely useful in practicality because there's just so many different variations and factors. It's unfortunately not like you see on TV.
Now, on page 2 of your report, do you begin to document Jesse's injuries?
Noted that he was only wearing light-colored briefs that were blood-stained and also very wet. He had no personal property that was on his body, but a blue earring was found within the body bag.
How about his weight?
He was 95 pounds.
What, if any, other observations did you make about Jesse during that external examination?
So he had some what we call skin slippage, or loss of the overlying layers of the skin. These can be caused by decomposition, where the bonds break down. But in this case, my opinion is that it's caused by exposure to heat, not obviously as direct exposure to as Jennifer's body was, but there was some heat near him. That's some superficial blistering is another word for it. And there's also some brownish discoloration, not quite charring, but just some changes of the skin on the body.
What, if any, post-mortem changes did you note about Jesse's body?
So he had rigor that was able to be evaluated. It was moderately difficult to break. He had purple posterior lividity that was slightly blanching, and his body was cool, but both bodies had been refrigerated.
I don't know if you explained it, but just lividity, what is that?
It's cooling of the body's, the blood in response to gravity. So in whatever position you die in, your heart's no longer pumping, the blood is going to settle downward to gravitational forces. After a certain, or before a certain period of time, it's still located within the blood vessels themselves. So you can actually push on the body's surface and physically move with your hand the blood out of those vessels. It's called blanching. After a certain period of time, those blood vessels themselves start to break down, and the blood seeps into all of the other body layers, so the fat, and that's called fixed because it's not in a blood vessel anymore.
So in this case, did the lividity tell you anything at all about Jesse?
Honestly, we document these things because they're part of the standard protocol, but they're very rarely useful in practicality because there's just so many different variations and factors. It's unfortunately not like you see on TV.
Now, on page 2 of your report, do you begin to document Jesse's injuries, both external and internal?
Yes, I did.
Okay, I'm just referring your attention to the bottom of page 2. How do you generally describe the characteristics of those injuries?
Can you clarify?
Yeah, I think there's 3 different things there, beginning with stab wounds of the torso.
Understood, yes. So in all of my reports involving injuries, I give kind of a summary statements of what type of injuries you see and what general body regions you see them in. So in this case, there are stab wounds of the torso and left upper arm. The torso is just the trunk of the body. An atypical appearing wound of the right side of the chin. I can describe that later. I couldn't classify it into one particular injury category, as well as evidence of smoke inhalation.
If you could please have slide 31 diagram. Doctor, what is this that we're looking at on the screen?
So this is a copy of the body diagram that I used during my external examination. You can see Jesse's name up at the top, his unique case number, which is 1300, as well as my initials, the date, and my tech's initials.
Are all of Jesse's wounds, or at least stab wounds, noted on this diagram, or these diagrams that we're looking at?
Yes.
Can you go over them on this diagram for us, just pointing them out, and then we'll go through each one.
Okay. So starting from the left side, there's wound A, there's wound B, and then further down on the left side is wound C. On the right side, the top of the shoulder is wound D. Then moving to the arm, there are 4 different wounds, but many of them are paired because the knife went through one side of the arm and came out the other side. So there's E and F on the bicep, and then there's H, I, J, and K that are on the top of the arm or around the axilla. And then there's also a wound near the left nipple, G.
We could have slide 28, please. Doctor, what are we looking at in general here?
So this is a photograph of Jessie's body. You can see his case number up at the top. You can also see this purple discoloration here, that's lividity.
Of the wounds that we looked at on the body diagram just previously, which of those wounds, if you put in terms of how you characterize them by their letter, which of those wounds are we looking at on this picture?
So this is A, this is B, this is C. You cannot appreciate D. It's under
Where would that be?
It's under the black box. This is very roughly the top of the shoulder up there. And then let me look at my report to see if this is E or F, just because the arm is rotated. So this is F.
In your report, under injury number 1, stab wound, back of left shoulder, do you see that on page 2?
I do.
Which injury does that correspond to on here? What letter?
So this is letter A.
Can you describe for us what you noted about that injury?
Yes, so it's slightly obliquely oriented or at an angle. There's no discernible blunt edge. And these are standard descriptions that we give of these external wound characteristics. The measurement on the skin was 1/2 inch long with the tension, 3/8 of an inch without the tension.
Now, after penetrating the skin, which direction did the knife proceed through?
So this went through the shoulder blade in towards the front of the shoulder and soft tissue of the left shoulder area.
And the estimated depth of the penetration is what?
So this went approximately 3 to 4 inches through the body. It did not enter the chest cavity. It was straight through, kind of towards the axle, if you will.
I'm going to refer you to injury number 2 in your report. What does that say?
So this is stab wound of the left upper back.
And can we see that in this photo?
Yes, it's lettered B, both on the photo and in the report.
Can you describe anything that you noted about this injury?
This injury does have some bruising around it, or some hemorrhage of the blood that's entered the soft tissue.
And how is it oriented?
So it's slightly obliquely oriented, but the other direction. It is 1/2 inch long on the skin surface with tension and 3/8 of an inch without tension.
Can you say anything about the direction of penetration and or the estimated depth?
Yes, so unlike in my report, which has a typo, it's actually back to front. The knife goes through the skin surface and struck a spinous process of the vertebral column. These are projections of bone that stick off the back of your vertebra so that muscles can attach to them. So because the knife struck the bone, it only went approximately 1/2 inch to 3/4 inch deep.
We can move on to wound number 3 in your report. What is that?
So wound number 3 is the C, the back of the left shoulder.
What, if anything, did you note about this wound?
This is a very similar appearance. It's obliquely oriented. It measures 3/4 of an inch long on the surface of the skin and 3/8 of an inch without tension.
After penetrating the skin, can you explain the direction that the knife proceeded?
Yes, it went through the soft tissue of the back and through the back of the chest cavity. It entered the chest, but there are no injuries that I saw to internal organs in the left side of the chest.
I'd like to move on to injury number 4. What is that?
That's D. That's the one that is obscured by this black box.
Okay. And what, if anything, did you note about that injury?
So this injury has a different appearance. It's 1.5 inches long with tension and an inch and a quarter long without tension. The wound edges are slightly irregular, leading me to think there's more of that pulling of the knife and or twisting of the body while this injury is happening.
And is that different from the other injuries that you just described?
The appearance is different, yes.
We can go back to this page. Oh, we have to, I'm sorry. If we could capture this, please.
That's 28.1.
Doctor, if we could move on to injury number 5 now in your report. What is that?
So this is a stab wound of the left upper arm and chest. And I should point out these next 3 wounds are all closely approximated on the body. So they're all involving the left shoulder or upper arm and involve a trajectory or a track that enters the axilla or armpit, as well as the chest, both in the axilla and then on the chest itself. So meaning to me that his arm was held in a position where it's against his chest, because I can follow 3 separate wound tracks in that direction.
So are you saying that the wound would have gone through the arm and come out the other side?
Several do, and then are associated with almost a re-entry stab wound on the torso. So went completely through the arm, and then the knife went straight into the torso.
Understood. Now, doctor, the slide that we just looked at, were you able to see those wounds on that picture?
I could see wound F, which is the inside of the upper arm. The arm is very tricky because I'm observing someone in this position, but obviously they can move their arm all around, and it can be difficult to measure as well as document the inside of the wounds. So I have a lot of pictures of different orientations so I can see which wounds match up to which wounds.
Now, doctor, of the pictures that you and I looked at, is there another picture that depicts those wounds that you just referred to?
Yes, I believe there's at least one picture that gets a large, most of the groupings of the wounds.
If we could please have slide 29. Doctor, what are we looking at?
Okay, so this is the left upper arm. So we are not seeing that wound on the back of the arm. That's lower down. This is just the very top of the shoulder and upper arm. And these wounds actually all connect. So this is sure I have the right one here. That's each. Yep. This is wound 4.
So the line that you have, the purple line with the arrow, is the outermost one? I'll let you say it.
Yeah, sorry.
It's okay.
It's hard just with the one photograph and not seeing the zoomed out picture to orient.
Okay, so you have I, K, and J.
Yes.
Now is that the order? Is that the order of the wound, sort of, in terms of entry?
So the knife entered the outside of the upper arm, went through the front of the upper arm, so in front of the, just make sure. It didn't hit the humerus. It went through the muscles of the upper arm, exited out the inside of the upper arm, and I'm retracting the arm out so you can see that this wound J represents a wound back into the axilla. So in reality, this picture is taken like this so you can appreciate all the wounds, but the wound path is actually like this.
Doctor, in your report, do you make certain notations about each of these wounds in your report?
I don't understand the question.
I'll refer you. So, wound number 5 in your report.
Yes.
What is that wound refer to on this picture?
So wound number 5 is not visible. That would be down here, an F. to be down here. So that's a lower down stab wound that is not visible in this one photo, where the knife went completely through the muscles of the back of the arm and exited out the front. After that, when you line all of these wound tracks back up, it lines perfectly with the stab wound in the left chest.
Doctor, if we can move on, and I want to get to that, but to wound number 6, what is that? And do we see it on here?
Wound number 6 is right here. This is H. This is the stab wound of the left upper arm. It's quite close to the top of the shoulder. This is one of the more atypical appearing, or not atypical, but one of the larger wounds on the skin surface. It measures 2 inches long with that tension and 2 1/4 inches without the tension. And this is another wound that it's difficult to appreciate on this photo, the exact pathway, because that knife actually goes in the arm and just travels through the musculature of your axilla and your upper arm. So it looks like it's connected to some of these, but it's actually just the knife goes in, doesn't come back out.
And then wound number 7, do we see that on this photo?
Yes, this is this complex of wounds that I highlighted here.
The IKJ?
Yeah, so IKJ, yes.
Okay, go back to the diagram.
Hold on, don't do that yet. Slide 29.1, please. All right, doctor, we could clear that, please.
So, doctor, on this diagram, the third one down, facing the photo to the right, where it says G.
Yes.
Can you just tell us about that? Because I don't think we saw that one.
No, that's not represented in any of the pictures we have. This is associated with these wounds here, B and F. So that's also under, that is supposed to be a Roman numeral V. So this is the knife going through the upper arm into the chest wall. And after this went through the chest wall on the left, it entered the chest cavity, but did not cause any internal injuries other than some bleeding into the chest.
Thank you, doctor. And then, was there another wound that you know in particular? I'm looking at wound 8.
Yes.
Is that on this diagram?
It is not on this diagram.
Okay. Is it in one of the pictures that we looked at?
Yes.
If we could please.
Can we print 31.1, please? So E, F, and G are all part of this, a single wound.
Yes.
So you can erase that when you get a chance, doctor, and then we'll go to the next. Okay, if we have slide 30. Doctor, what are we looking at in this slide?
So this is this wound 8, wound of right shin. So the feet are towards this way. This is the mouth is up here. Okay, the head would be towards the top of the screen. And this wound is very shallow. It does have some features that I would lump in the gunshot wound category. So it's got a central punched out defect. As I say, gunshot wound, entrance wound category. And then this, so this is the hole. And then this is what we call a margin of abrasion, meaning that the bullet struck the skin at an acute angle and scraped the skin off. But because this is such a shallow wound and there's no track in the body, I was not comfortable classifying it definitively as a gunshot wound. But with this appearance of the outside, and there's a depressed fracture of the underlying mandible of the jaw, I think this is very reasonable to believe that this is some type of what we call atypical gunshot wound.
Doctor, can you just orient us on yourself? Whereabout is that wound?
So it's about here.
For the record, the doctor pointed to the right side, just below her lips, down towards the bottom part of her jawbone. Slide 30.1.
Doctor, did any of the stab wounds that you described or the wound to the chin hit any major organs that would have caused immediate blood loss?
Not immediate fatal blood loss or fatal organ injury, I should say.
Now, after you note these particular injuries, your report goes on to discuss the internal examination. I'd like to draw your attention to page 5 where it says neck. Do you see that?
Yes.
What, if anything, did you note about this area?
So as I did in Jennifer's case, I removed the entire respiratory system in block, tongue, trachea, bronchi, lungs, and opened that up so I can see if there's any soot deposited anywhere in the breathing pathways. So this had a small amount of dark colored material that was a little bit further up towards the, near the vocal cords, so towards the top.
Did that mean anything to you?
Again, this is a soft sign that somebody was alive at the time of a fire, bringing in that particles, those dark particles, that soot.
Doctor, your report goes on to discuss your examination of the respiratory system. Do you see that?
I do.
And what, if anything, do you note about that, or did you note?
So further down where the trachea splits into the vein stem bronchi, going to the right and left lung, there was some similar appearing dark material there.
Now, what, if any, testing was conducted with respect to smoke inhalation?
So in addition to a comprehensive toxicology panel, I requested a carbon monoxide exposure screen, as I did in Jennifer.
And what were the results of that?
So this is the result of that 8% carboxyhemoglobin. So 8 of the 100 hemoglobin molecules had carbon monoxide bound to them.
And just what does that mean, if you could explain that to us?
So when we have fire deaths, we always send for carbon monoxide. We want to make sure that it is elevated enough to explain the death. Obviously, if we have a death that's billed as a fire death and the concentration is 0, that's concerning that something else happened and the fire was set to obscure that. Lower concentrations can be fatal in people that have significant underlying disease, such as in elderly people with heart disease. It can be difficult to interpret at the lower levels because normal individuals can have anywhere from 2 to 3.5%, depending on which textbook to read, that is just breathing in our environment. People who are smokers, I've seen reported anywhere from up to 5 to 8%. But so his 8% is in that range, but because I don't have the history that Jessie was a smoker, I believe this is all from inhalation of that carbon monoxide during a fire.
Now, could you determine at the time of Jessie's death whether he was suffering from any natural diseases?
So after I examined all of the organs and all of the organ cavities, he appeared to be a standard 11-year-old in good health.
Could you determine whether any natural causes contributed to Jessie's death?
There was no natural disease present to contribute to his death.
Now, based on your examination of Jessie Canerio, and in light of your education, your training, and experience, were you able to come to a determination as to the cause of his death?
Yes.
And what was that?
So in this case, I gave it a cause of death and a contributing cause of death. So similar to Jennifer, his mechanism is blood loss and the inability to deliver oxygen to his organs, but he had while hers was just blood loss, he has the addition of having that carbon monoxide that is going to limit his oxygen carrying capacity. So I listed the stab wounds of the torso and left upper extremity as the cause of death or the main cause of death, but then the contributing cause of death is smoke inhalation.
And what did you base these conclusions on?
My years of training experience, the autopsy I performed on him, as well as the several or many other autopsies I performed on both homicide victims and fire victims.
And based on your examination of Jessie and in light of your education, training, and experience, were you able to come to a determination as to the manner of his death?
Yes, I was.
And what was that?
So similarly, the
Damning evidence. And with this, the defense tries to introduce a new theory. Attempting to rope Paul and Keith's other brother into this massacre, they sneak evidence into the proceedings. And it happens fast, so pay attention.
Recognize this as your sister's call log?
Yeah.
Okay, I'm just going to direct your attention to the second page here, and, specifically this call, and the time would be listed here if you want to take a look at that and then look up when you're done.
Okay. Yeah.
Okay, so what time did your sister call Lisa?
5:43 in the morning.
Now, during that call that your sister made to Elisa, did your dad speak to Corey?
Yes.
Okay. And as a result of that call, what happened?
Corey drove to my house.
Okay. And so the call was at 5:43. Approximately how much later did Corey get there? How long did it take to get there?
Like a half hour later.
Okay, so that would be approximately what time?
6:15, 6:20.
And was it still dark out?
Yes.
And how did Corey get there?
He drove.
What kind of car did he drive?
He had a white Jetta.
Now, do you know where Corey was coming from that morning?
Yeah, he and his family lived in Fairhaven.
And approximately how far away is Fairhaven from your house?
20 to 30 minutes.
20 to 30 minutes?
Yeah.
Like depending on traffic?
Yeah, during the day it takes a little longer because there's no direct route.
And once Corey gets there, approximately how long is he there for?
He stayed until around 9:30 in the morning.
Okay. And at some point, did you go anywhere with Corey?
Yeah, he drove me and my sister to go grab bagels.
And after that, approximately what time did you guys get back from the bagels?
We were probably gone for like a half hour, so maybe. We got back from getting the bagels and he pretty much left. He had an appointment somewhere.
Okay. And so Corey leaves, and then after that, what, if any, additional calls were you making that morning?
I called my Aunt Jen and Uncle Keith a bunch of times.
And when you say you called Aunt Jen and Uncle Keith, like what numbers, not the phone numbers specifically, but like what phones are you calling?
I called my Aunt Jen's cell phone, I called my Uncle Keith's cell phone, I called the house phone, and I called Jessie's iPad.
And of those, so it was the Keith's phone, Jennifer's phone, the house phone, and Jessie's iPad.
Mm-hmm.
Four phones?
Yeah.
Of those four, did any of them not ring?
Yeah, the house phone went straight to voicemail.
Okay. And so how many times did you call the house line? If you
Just
recall?
once.
Okay. And why did you only call once?
Because it was off. There was no point.
Okay. So the phones that were ringing, you continued to call?
Yes.
Okay. Approximately in total, how many times would you say you called those phones that morning, like in total?
About 20.
And
No one answered.
And specifically with respect to Jennifer's phone, was her phone ringing?
Yes, it rang normally and then went to voicemail.
What was the approximate time frame that you were calling these phones that morning?
I would say from 9:30ish to 12.
That's approximate?
Yeah.
And to your recollection, did Jennifer's phone ring?
Yeah.
Were you also sending text messages that morning?
Yeah, I texted my Uncle Keith and I texted my Aunt Jen.
Do you remember the time that you sent your Aunt Jen a text message?
No.
No? Would seeing a copy of the text message with the timestamp help refresh your recollection?
Yes.
I am approaching with what's been marked as D154. Okay. I'm just going to direct your attention to the name. Okay. And the specific text with the... Okay. Does that help refresh your recollection of what time you sent a text message to your Aunt Jennifer?
Yes.
And what time was that?
10:26 in the morning.
Okay. Now, what kind of phone does your Aunt Jennifer, what kind of phone did your Aunt Jennifer have?
She had an iPhone.
And do you still have that text message in your phone today?
Yes.
And did you look at that text message recently in the past day or two?
Yes.
Now, prior to the last day or two, when was the last time you looked at that text message?
The day I sent it, November 20th, 2018.
So you haven't looked at the message since?
No.
When you looked at it in the last day or two, what, if anything, did you notice about that text message or iMessage? Is it a text message or an iMessage?
It's an iMessage, and it changed from delivered to read.
So, do you have any idea when that would have changed?
No, I didn't look at it for 7 years.
The fact that it now says read, did that stand out to you?
Yeah, because who read it? He wasn't alive to read it.
Turning back to the scene of your house fire. What were you and your family doing while first responders were on scene?
We were in my mom's car, and then we would occasionally use our neighbors' bathrooms.
And which neighbors were you, whose bathrooms were you using?
I personally used Marilyn's, my next door neighbor, and then John Harrington's across the street from me.
And were you speaking to your neighbors during that time as well?
Yes.
At some point, did anyone in your family need something from your house?
Yeah, my dad has diabetes, so he needed the insulin from inside the house.
And were you able to get the medication?
Eventually, yes, but it was difficult to get. I had to keep explaining and going back and forth, trying to say why he needed the medicine. Because they said that they had to take pictures of the whole house and then we would be able to get in, but he needed it sooner than that.
Now, at some point, was there a search? And so ultimately, did he get the medication then?
Yes.
At some point, was there a search of your dad's vehicle?
Yes.
And when I say your dad's vehicle, which vehicle are we talking about?
It was the Porsche Macan Loaner.
And you reference it as a loaner because...
His car was in the shop at that time.
Okay. And around what time was the search of your dad's vehicle?
10:40.
And was your dad present for the search?
No, we walked up the driveway to go see, and when we got to the top, they told us we had...
Objection, hearsay. When you got to the top of the driveway, were you permitted to stay for the search?
No.
And where were you directed to go?
The street.
And could you see the search from the street?
No.
But were you able to take some photos?
Yes.
Now, during during this time, where's Marissa, your sister?
My sister's boyfriend at the time picked her and the dogs up so that the dogs weren't just in the car anymore, and they took them back to his house.
Okay, so your sister left with
Her boyfriend at the time. Yep.
and the dogs?
And the dogs.
Okay. And how did she leave?
He picked her up.
Do you know approximately what time this was? Approximate?
I really don't, but I want to say around 10:15, 10:30.
Okay. Now, at some point, was there a request for you to go to the police station?
Yes.
And around what time was that?
11:30, 11.
Physical phone that documents the screenshot, that physical phone and what's located there, do you agree with me that's an electrically a stored document within her phone? Do you agree?
From the moment she took it, sure.
And from the moment that you knew about it, correct? It's an electronically stored document, right?
I don't know if that's within the context of the discovery.
I'm asking you a question, yes or no. The answer is either it is, or in your opinion, or it's not. So
in my opinion, it is electronically stored in her phone. Yes, is it electronically stored? As far as do I have access to her phone? I didn't have access to her phone.
Well, actually you did, because you actually got a screenshot of it, according to you, the day before. So you did have access to not only to her phone, but the fact that you received a screenshot of it. Am I correct?
I would disagree, Judge. I'm on the phone with Katie. She's giving me information in live time. This is less than 24 hours before she's set to testify. And she informs me of something for the first time, and in live time says, and by the way, here's a screenshot of it. So this is less than 24 hours before she's testifying. It's not clear that this is, my understanding is if I'm not going to actually use the physical item, I didn't think it would be necessarily fair. I have to say, I had a fleeting moment to really think about it. But I didn't think it would be fair to surprise the state with this document and say I'm going to use this tomorrow, or I plan to use this tomorrow. So I relied on what she verbally told me to elicit the testimony. I think those are two distinguishable things.
I don't think they are. I don't think they are at all. I actually think that you had 24 hours, according to you, if you're actually assuming your information is correct, that you had a significant amount of time, that you had a screenshot of information that you knew you were going to elicit the next day, and that you did not turn it over. You didn't turn it over on Sunday. You didn't turn it over on Monday morning at 8 o'clock when we're all here a half hour before we started. You didn't turn it over at the first break at 9:30 or 10 o'clock. You didn't turn it over at the second break that we had at 11:30. You didn't turn it over at 12:30 during the break at that point in time. And you obviously didn't turn it over even after you asked the question about it. It wasn't until it comes up where I'm getting a brief at 10 o'clock at night, some 6 hours after the testimony, for the first time, the screenshot shows up and is now a part of this case. So yeah, you did have time. You absolutely had time to turn it over, and it's not a fleeting moment. You knew with other text messages that you had, where you got somebody's phone records in the past, you actually turned those messages over. So you know that you actually have to turn over something that's in somebody's phone because it's electronically stored information. And the reality is that you decided not to do that. You intentionally and deliberately decided not to turn over discovery that you had in your possession before such time that witness took the stand. So the state, at least at that moment, could have had the opportunity to say, hold on for a minute, we want to do some research on this before it comes out on the stand. Tier says one thing, it does. But Tier does not mention, and it does not deal with the fact when something, it's not created by you. No one's asking you to create anything in this case. It already existed. This information was stored in her phone It existed. You knew about it. You didn't turn it over. There's a difference. That's not what Tier is talking about. This in this court's opinion aligns more with State versus Knight. That is a 2024 decision, which I'll get into in my decision, which directly, in this court's opinion, is a situation where the defense has certain rights, and there is, I'm going to use the word imbalance, but only to the extent to preserve the defendant's constitutional rights. The defense does not have to turn over as much information that the state does. However, the discovery rules make it clear that electronically stored information needs to be turned over. You had it, and you didn't turn it over. So if your answer is anything other than, when I ask you if it's electronically stored information, if the answer is anything other than yes, it is, I got a problem with what you're saying. So I'm going to give you another opportunity as you're talking to the court. When you look at this information, is it or is it not electronically stored information?
Judge, frankly, I don't know. I don't think it's clear. Again, my interpretation of the discovery obligations are that if I am using something at trial, a physical, extrinsic document or piece of evidence, then I have to turn it over. And there were many things that were turned over months ahead of time because I had them months ahead of time. All I can say is I had this item the day before she was going to testify, and if I had not had the item, if it wasn't sent to me, and all I had was her verbal information, I would have just elicited the testimony. So I was relying on the verbal information, not the extrinsic information, to elicit the testimony. And that's all I can say.
That is...
If Your Honor disagrees, then Your Honor disagrees. That's all I can say.
I do disagree, because you know what you're doing? You're trying to walk a fine line and a tightrope on this situation, but you know that electronically stored information needs to be turned over. So that is why you're saying, I'm going to rely on the testimony that you know has electronically stored information to it. You know it. And you decided in a deliberate attempt to not turn it over, that you would just elicit it on the stand outside of turning over the physical screenshot in advance. So the state has some clue as to what was going on. The state didn't even have the opportunity to object. It happened so fast. So the reality is simply this. I hear you as it relates to this issue. I 1,000% disagree. This is not what the Supreme Court at any point in time contemplated when it considered Tier. This is not what it did. There's no way. And when I look at State versus Knight, it shows me that there are certain situations where the defense has to comply with the discovery rules. And this is not going to be trial by ambush, not in this courtroom or not in this state. So that's number one. Let's move on from the text message for a minute. I want to talk about the issue of these locations from February 2019. The electronic location that she looked at from 2019, is that stored in her phone as of today?
Not that I know of. She's just relaying what she saw back in February of 2019.
That's not what I'm asking you. I'm asking you whether, obviously, you're having a conversation with her as it relates to the other text message. And there, she's like, I have a screenshot. I can't sit here and not think that somebody who's preparing a witness in a case like this wouldn't ask a question. Do you have anything in your phone that says that the location comes back to Corey's house in February 2019? Are you saying that you never tried to see if that information's electronically stored in her phone?
That's exactly what I'm saying. I didn't ask that question because she just mentioned that when back in 2019 she looked at it and saw that it said that it was at Corey's house. And because I was under the impression that they obviously had the iPad at some point but never seized it or searched it the same way that they did to Sophia's phone. And just so that the record is clear, I also want to note the text message that she sent to Jennifer, the state did a cell phone extraction. They have her cell phone extraction. When I refreshed her recollection, I wasn't using...
I know you weren't. That's what makes it even worse. You decided to use an electronic document that you know was not 100% accurate, because the document that was 100% accurate to refresh her recollection would have been what you had in your possession, which was the screenshot, which included underneath the word red, which is what you supplied in your exhibit. So you had something, again, in your possession that you consciously decided not to turn over. And then when you're deciding to refresh somebody's recollection, you decided to use a document that, okay, this is in discovery, so I'll use this, but then I'll ask questions and get a verbal response as to the other information that's electronically stored in the phone. That's not appropriate. It's not in any way, shape, or form. The other part of this is that you're saying in your footnote on page 2 that defense counsel further recalls the witness mentioning, so I guess this is during a conversation that you had with her, that she confronted Corey about it, either text or phone call. Do those exist?
I don't know, Judge. I'm being in candor to everyone. I'm just relaying the context of the conversation and what was told to me. That's all. The court is clearly being accusatory toward the defense. The court is using words such as conscientious or conscious and deliberate and intentional.
I'm using it because it's true. I'm using it because it's true, Ms. Maslone. So don't say that I'm using these words for any other reason, because you did this. I didn't do it. I've given you the opportunity to ask questions and do whatever you need. And the reality is, you can roll your eyes for the record as you just did, but the reality is simply this. You were given the opportunity under these circumstances to turn over electronically stored information, and you didn't do it.
If that's the court's finding, then that's the court's finding, Judge. It doesn't seem to me that there's anything that I can say to further my position that this was not a discovery violation, nor was it an intentional discovery violation. So if the court finds otherwise, and the court clearly has, then there's nothing further that I can say. The defense has made every effort to try to be transparent in light of the fact that of the unique nature of this case. I've never had a case where I've had to go to sidebar so many times to make sure that it's okay to ask certain questions, as I did before Katie Canerio's testimony. This was not something that I anticipated would be an issue. I elicited something that she verbally told me, and that was it. There's a 25-page ex parte letter that pertains to Corey Canerio. The court made rulings. I advised the witness accordingly of what she was and was not permitted to say. This was something that came up at the last minute that didn't seem to me to have the message about Jennifer's phone has nothing to do with Corey Canerio.
Didn't I rule as it relates to any post behavior by Corey and/or his wife or ex-wife that I was not going to allow some of this conduct to be brought out? Didn't I say that in my January 27th?
Absolutely, and this wasn't...
Okay, so hold on.
It was just failure to investigate and seize and search the iPad.
No, that's actually not, because the first thing that you say...
is that people were in the home.
I'm sorry, I think I was talking. The first thing that you say deals with the fact that they are in the home. They are in the home taking stuff out. It demonstrates that Corey was taking items from the house after the homicide, which lends to further credence to the defense's earlier point.
Yes, exactly.
The reality is this. It goes to his behavior. It doesn't go to the fact of something that happens in 2020, a contamination of the scene in 2020. It's not like we have evidence here of Corey's DNA in the kitchen so that we have some contamination issue. What this evidence is being used for is to show that Corey is actually in the house just taking items out, and it goes to his behavior. That's what I find. It goes to his behavior, which is exactly what in my January 27th order of a 42-page opinion, which I said specifically that that area of testimony was not going to be allowed.
It wasn't elicited, Judge. If I can clarify, I was simply explaining that the Tiffany's boxes, those photos, those were taken in 2000, I believe, early 2019, around the same time frame by the insurance company, if I'm remembering correctly. That was testimony about the Tiffany's box that was elicited, and Your Honor, I think, had said it goes to scene contamination because the swabs were not taken for an entire year later. Additionally, there was testimony about Elisa taking shirts or clothing from the house. That was prior to the swabs being taken. So there is testimony.
Who testified to that? Who testified to Elisa going into the house and getting stuff out?
Judge, could I just...
It might have been a mix between Petrozello and Detective Vogt.
I think there was...
Who specifically testified that people went in the house, that they saw them go in the house and take stuff out? Or contaminated the scene?
Well, that would be Detective Vogt, not specifically as to the shirt.
After a lengthy trial, justice is served and Paul is found guilty of murder and arson charges. Sentencing for the murder charges ranged from 30 years to life imprisonment, with enhanced charges for the murder of juveniles. Even if he only gets the minimum sentence for each charge, he will be spending the rest of his life behind bars where he belongs.
Communication between the court and the jury. So I'm going to go through each one of the questions with you one by one, and you'll just answer the question after I read it, okay? All right. If you don't mind, can you stand for me? Unless you're uncomfortable. Do you have your verdict sheet?
No.
Okay, do you want to get that?
Yes.
All right. Okay, sir, we'll start from the top. All right. How do you find as to count one of the indictment charging the defendant, Paul Canerio, with the murder of Keith Canerio?
Guilty.
Did the defendant, Paul Canerio, commit the homicidal act by his own conduct, meaning the defendant actively and directly participated in the homicidal act?
Yes.
Did the defendant, Paul Canerio, commit the murder in expectation of the receipt of anything of pecuniary value?
Yes.
Did the defendant, Paul Canerio, commit the murder for the purpose of escaping detection, apprehension, trial, punishment, or confinement from another offense or offenses committed by him, the defendant?
Yes.
Did the defendant, Paul Canerio, commit the murder while he was engaged in the commission of or an attempt to commit the crimes of murder?
Yes.
Okay. Count two. How do you find as to count two of the indictment charging the defendant, Paul Canerio, with the murder of Jennifer Canerio?
Guilty.
Did the defendant, Paul Canerio, commit the homicidal act by his own conduct, meaning the defendant actively and directly participated in the homicidal act?
Yes.
Did the defendant, Paul Canerio, commit the murder in expectation of the receipt of anything of pecuniary value?
No.
Did the defendant, Paul Canerio, commit the murder for the purpose of escaping detection, apprehension, trial, punishment, or confinement for another offense or offenses committed by him, the defendant?
Yes.
Did the defendant, Paul Canerio, commit the murder while he was engaged in the commission of or an attempt to commit the crimes of murder?
Yes.
3. How do you find as to count 3 of the indictment charging the defendant, Paul Canerio, with the murder of Jessie Canerio?
Guilty.
Did defendant Paul Canerio commit the homicidal act by his own conduct, meaning that defendant actively or directly participated in the homicidal act?
Yes.
Did the defendant Paul Canerio commit the murder in expectation of the receipt of anything of pecuniary value?
No.
Did the defendant Paul Canerio commit the murder for the purpose of escaping detection, apprehension, trial, punishment, or confinement for another offense or offenses committed by him, the defendant?
Yes.
Did the defendant Paul Canerio commit the murder while he was engaged in the commission of or an attempt to commit the crime or crimes of murder?
Yes.
Did the defendant, Paul Canerio, commit the murder while Jessie Canerio was less than 14 years old?
Yes.
Count 4. How do you find as to count 4 of the indictment charging the defendant, Paul Canerio, with the murder of Sophia Canerio?
Guilty.
Did the defendant, Paul Canerio, commit the homicidal act by his own conduct, meaning the defendant actively and directly participated in the homicidal act?
Yes.
Did the defendant, Paul Canerio, commit the murder in expectation of the receipt of anything of pecuniary value?
No.
Did the defendant, Paul Canerio, commit the murder for the purpose of escaping detection, apprehension, trial, punishment, or confinement for another offense or offenses committed by him, the defendant?
Yes.
Did the defendant, Paul Canerio, commit the murder while he was engaged in the commission of or an attempt?
This has been a presentation by Criminal Aperture. Consider subscribing if you enjoy the content. As always, be safe, stay aware, and we'll see you in the next one.